music enhances or activates all your sensory portions of your body all at the same time. So we know music does that. So you walk in, you got music going on. If you need help with your image receptor, who's going to be your best friend? The anesthesiologist. Can you put this underneath the table for me? Sure. And they put it underneath. Less work for you. And while they're doing that, sit there and have a conversation with them. Hey, what's going on? What's new? Okay? You get the new Sony game online? Okay? You're having a conversation. It's a different environment nowadays. So, yes, it is intense, but it's not like what it used to be. Okay? So give the image receptor to the anesthesiologist. They'll help you put the cassette underneath. All right? And if you have to do it yourself, remember you only got 2 other areas. It's either going to be at the foot or the opposite side of the sterile corridor. When you lift up the drape to put your image receptor in, make sure that it's not going above the edge. Okay? Now, let's just say, now I'm ready to do an x-ray. Where's your x-ray tube going to be? It's going to be on top of the patient, right? So now that's on top of the patient. Well, don't you have to lean over the patient to set up your x-ray tube? And am I not over the opening of the patient? Yes or no?
Yes.
Yes, you are. So, when you are getting ready to put your x-ray tube on top of the patient, what the doctor and the assistant is going to do is they're going to throw another drape over the patient. So that way, if you lean over it and touch it, you're not contaminating the area. You've contaminated what they put over the patient. Bless you. But once I'm done, they can simply remove what they put over there and discard it.
So they cover the opening in the patient?
They cover the opening. So that way you are not sloughing off anything off your body and onto the surgical opening. So there's going to be another protective cover over them while you're taking the x-ray.
So pretty much the procedure stops and you take your x-ray.
Exactly. Yes. Does that make sense, guys? Okay. So be familiar with the sterile corridor. Maintain and preserve a sterile environment. Portable imaging units may need to be cleaned prior to entering the surgical suite. Okay. The radiographer in the OR. As
book title.
Huh?
It sounds like a book title.
It probably is. Aware, you need to be aware of protecting not only yourself, because again, we're going in there to shoot what? X-rays. Are we using radiation?
Mm-hmm.
Yes. Is radiation dangerous?
Mm-hmm.
Yes. Okay. We are bringing a radiation equipment into the room. So, you have to make sure that not only you are protected from radiation, because we're going to put on a lead apron, right? Because we're staying in the room during the procedure, right? We're not leaving the room, right?
Mm-hmm.
We're going to be around the x-ray equipment when we're making an x-ray exposure. But we also have to make sure that the personnel in the room are also protected from radiation. At this point, the doctors may now leave the sterile corridor. Okay, because there's my x-ray tube. You don't want to be, as a physician assistant, standing right around the vicinity of the x-ray source, or do you? You don't want to, right? So when that happens, once everything is set up, the surgeons and their assistant and other personnel are going to move away from the source. Again, being conscious of what? That you're not touching anything or brushing up against anything. Because I'm sterile, I want to make sure I'm not touching anything, because if it's sterile and non-sterile, you've now become what? Contaminated. So be aware of your surroundings. As a technologist, I'm also going to be aware of that personnel, and I'm like away from them, making sure I don't touch them. Yes?
Since scatter radiation happens, wouldn't they have to wear a lead apron?
Yes. So, because scatter radiation happens, prior to the doctor putting on their surgical attire, they also want to make sure that they have their lead apron on as well. So they know that prior to beginning the surgery. But it's your responsibility as a technologist to make sure that they're wearing the lead apron. If not, then we need to get them away from the source. If they're only going to be about 3 or 4 feet away, make sure that they are still protected with their lead apron, or we're going to put a barrier between the source and the surgical personnel.
Like a portable barrier, or
Some kind of portable barrier, kind of lead barrier, and I'll have some pictures of that. Okay, so it is your responsibility as a technologist to make sure that everybody is protected from radiation.
So what about the patient? For the leg?
They're going to get exposed.
That's something.
Yeah, it's an X-ray procedure. If they're pregnant, or if they're in childbearing years, we will make sure that they have a protective covering on them as well before the procedure.
So those for the.
Otherwise, they're getting an X-ray. It's an X-ray procedure. They're going to have to get exposed. Yeah. Good question. Okay. So this is, you'll have a barrier like this. Okay.
they're all happy, huh?
Okay.
Happy
But
doctor.
again, you want to make sure if you're sterile, you're not touching it. You're just standing behind it. If you touch it, again, sterile or non-sterile, what happens? You're contaminated. You got to remove all your scrubs, go wash up, and put on new sterile attire. Okay. So you have your options. Everybody's protected, wearing a lead apron, or there's a barrier between them, or we have them step a minimum of 6 feet. Okay, minimum of 6 feet away from the source of radiation and the patient. That is your minimum requirement when doing a portable examination. Is you stand away a minimum of 6 feet away from the X-ray source for the patient. Okay? As you said earlier, the radiographic machines must be cleaned with a disinfectant solution. Sterile technique must be followed and maintained at all times. Here is an example of utilization of a C-arm where the X-ray equipment and the image receptor is above the patient the entire time. We also got to put a sterile covering over it so there is no contamination of the equipment on the surgical or invasive area. Okay? This technologist can touch this covering in this area here because it never comes close or come in contact with the patient. So she's able to touch that. But she cannot touch this area over here because this is the area that's in close proximity of the patient. Okay. If radiographs are required during the procedure, let's just say, for example, that the image receptor that I have to obtain an image doesn't require it to be put underneath the table, but directly underneath the patient. We've got to encase it in some kind of sterile packaging to make sure that we don't contaminate the area during the procedure. Okay? There are some instances where the image receptor, the cassette, has to come in contact with the patient. Remember, sterile on sterile. So this technologist here is giving the non-sterile image receptor, giving it to the assistant, and they're placing it in a sterile bag. Once it's inside the sterile bag, now the image receptor can come in contact with the patient without contamination.
That doesn't affect the image in any way?
Nope. Yeah, X-ray shoot right through it. It's plastic. It's just going to go right through it. So the question was, does it affect the image in any way? The answer is no. X-rays go right through it. Yes.
In that image, I mean, when you're in the room, you have to have all hair covered. Shouldn't he be wearing a long sleeve gown?
Who, this guy right here?
Yeah.
Well, he's not part of the sterile procedure.
Okay, so you can.
He does not have to.
So not all
Yeah.
hair needs to be covered if you're not sterile. Okay.
Now, only those who are, again, directly involved with the patient. If you're coming in contact with the instruments, yes.
Okay.
Here, he's not.
Got it.
Okay. Any questions here? Okay. If the radiographer places the image receptor in himself, care and caution must be taken so not to contaminate the field or scrub personnel. Remember the sterile corridor. Remember the edge of the table. Okay, whether it be your instrument table or the draped patient, not to lift the drape over the edge. This may require some assistance in positioning the image receptor underneath the sterile drape. Again, be cautious of your environment as to not contaminate anybody or anything. Assure the scrub personnel are wearing lead protection. Have the remainder step away from the radiation source or behind a protective barrier. When the hand, if the surgeon needs to hold the patient in place during a procedure, you want to make sure that they are wearing radiation or lead-lined gloves so that they're not exposed to the radiation. Okay? This is only for those who are, if their hands is around the X-ray field, it protects them. Okay. Any questions? So here's an example of one using the serum with the fluoroscope machine. The X-ray serum machine has a sterile covering over it, and the doctors are visualizing their procedure on the monitor there during the procedure. If you're pregnant, you should not be in the suite during the radiation exposure. If you're pregnant, you should not be performing these type of procedures. Okay. Do we have pregnant technologists and pregnant surgeons that are working around radiation sources?
Mm-hmm.
Yes, we do. I've worked with pregnant physicians all the way through their entire pregnancy working in the cath lab. And they're like next to the radiation source. They do that because they understand the beast, they understand the animal. So they know how to protect themselves. So although they're working around in a radiation environment, they still know that the amount of radiation that they are receiving is minimal and that they should be wearing a lead apron. Okay? They're wearing a lead apron to protect themselves, but they're also protecting their fetus or embryo. Okay? What else is protecting the child? It's not just the lead apron, but remember the fetus or embryo is inside the abdomen, surrounded by fat and different types of other tissues. Okay? That's why you can have pregnant physicians and pregnant technologists working around a radiation environment. Well, we tell them not to, so we can minimize the chances of any type of birth defects. The radiation badge should be worn outside the lead apron at collar level, so as technologists, we are wearing a badge because you are in a room during a radiation exposure. We're going to keep track of the amount of radiation that you can get. Remember, in this type of environment, you are going to get exposed to radiation. There's just no way around that. However, you are allowed a certain amount of radiation a month. And as long as you are below those limits, you're good. Okay, remember, I'm still a practicing technologist. I've been doing this for 25 years, and I'm doing fine. Okay, I've kept my radiation limits below the threshold. You make sure that all surgical instruments are removed from their radiographic field and that incision site is properly draped. Remember we said you're going to be leaning over the patient to set up your X-ray tube. Okay? Make sure that the site is covered. You also want to make sure that there aren't any instruments laying around your field during the exposure because it'll show up on the X-ray and may inhibit the study. Okay? Any questions? All right, the last portion that we're going to talk about here is sterilization and disinfection. Remember, sterilization isn't complete until the spores have been completely removed. The instruments that we have here, these are all sterilized. We remove all the pathogens, the microorganisms, including their spores. There is nothing living on it. The method of sterilization depends on the items being sterilized. The packaging themselves should have an identifier to let you know what's inside the package. Okay? And it should also have different types of stickers or markers in there that tells you the expiration date.
Does it expire?
It does expire, yes, it does expire. So my next question is, let's say I have an equipment here and it says, what's today's date?
13.
The 13th, okay. It says expires September 13, 2016. Can I still use it?
Oh yeah.
Yes. What if it said September 14? Can I use it?
No.
So yes, because I still have a day.
Oh.
I went the other way. What if it says September 12?
No.
Okay. If it says September 12, the day after, I cannot use the equipment. We discard it. If there isn't any type of markers or labels or identifier here that tells me what's inside the package, can I use it?
No.
You discard it. If there isn't a date on here, should I use it? You discard it. When in doubt,
Leave it out.
toss it out. Leave it out. Get rid of it. Okay? When in doubt, get rid of it. Throw it out. Yes?
For the equipment, like the tools and all that, do they ever use that as well, or do they discard it?
No. There are certain instruments that you can use over and over again. Yeah. So those would be like your stainless steel type of equipment. And we're talking about sterilization. Okay. Other items and surfaces that cannot be sterilized. Patients' tables, the walls, the floors, the counters, the IV poles. Okay? Those things have to be wiped down with a disinfectant solution. Remember what we said, solutions used for skin preparation is called antiseptic. So the area where they perform the invasive procedure, okay? We're not using a disinfectant, we're using an antiseptic.
Then nowadays, some places they sterilize the room with light. You know,
UV light.
UV light.
There was a comment here that some of the rooms can be sterilized with a UV light. Yes, but it's not 100%. Because remember, you still have endospores, you have cysts floating around the air. So you even have those that are resistant to not only chemicals. Remember, that's why medical asepsis is only 99.9%. You still have those very, those super strong type of microorganisms. Same with UV light. It's not 100% effective, but yes, it can be used, and we can minimize the amount of pathogens in the environment. Okay, disinfectants. Disinfectants are categorized by their disinfecting ability. You can review this in your book, okay? There is high level, intermediate level, and low level type of disinfecting. Okay? So it depends on what we're trying to disinfect. Is it an area that's high, there's a higher chance of risk of infection, or is it a low level type of risk of infection? So it all depends on the type of methods that we use to disinfect an area. Now, here is something that I don't know if I mentioned this before. A lot of the material that we use in the hospital are also household items, like your 409, like alcohol. Okay? The only difference is one says for medical use. They're basically the same chemicals, but they charge you 5 times as much. Okay? Items to be sterilized or disinfected. Okay, so here's the ability. We can also classify what's being disinfected or sterilized by the risk of infection on a patient. This is known as a Spalding classification. Items to be sterilized are classified based on the risk of infection on the patient. This is known as Spalding classification. It's either critical, semi-critical, or non-critical. So this is what it is. So depending on, again, what you're trying to sterilize will depend on the type of sterilization process. If you guys have heard in the news recently, the last couple of years, we're talking about laparoscopic procedures, okay, where they go down the throat, for an example, okay? One of them is exploratory laparoscopy, where it goes down the throat and look at the different areas of the intestine. Those type of equipment are basically wiped down, okay, with a type of disinfectant. the GI tract is considered dirty. It's dirty anyways. So they don't sterilize their equipment, they just disinfect it. Well, what's happened is, because they haven't completely sterilized the instruments, those that have survived, they mutated into a super type of bug. They got stronger. Have you heard a lot of those people getting sick in the last few years after they've had a GI study? Okay, there was an increase of that in, again, big, well-known hospitals in the LA area. Okay, so now they're saying, oh, let's not just disinfect it, let's sterilize it. So that's what they've been doing now, is sterilizing their equipment. But again, it all depends on whether or not what the instruments are used for. GI studies, GI type of equipment, disinfected, some sterilization. Those are where you're doing with open heart and there's a greater chance of infection, okay? Such as open heart or organ transplants. Now they're using equipment that have been critically sterilized. Okay, just remember this. Just remember the Spalding classification. That's all I need you guys to know. Yes?
Does that also depend on the person's immunity?
Pardon me?
The person's immunity? Does that also
No, it's all going to be treated the same way. Yeah. Okay, so just remember the Spalding classification. Common types of chemical disinfectants, you guys can look in your book. What I want you to just be familiar with, that there's a whole chart in there. I don't expect you guys to know all the different chemicals. What I do want you to understand that there are different chemicals for different instruments and for different types of procedures. That's all you need to know. That there isn't a one-size-fits-all type of disinfectant or sterilization.
So you don't want the name, but
No, just what I want you to know is just know that there are different
It's not
types.
just one chemical.
Yeah, there's not one chemical, there's not just one process. That's all I want you to know. Okay. Physical disinfectant methods includes boiling. However, with boiling, even at very high temperatures, spores can survive. Sometimes in the boiling process, they will add sodium carbonate that cuts the boiling time in half. Okay, but again, you will still have surviving spores. We talked about ultraviolet rays. It's a disinfectant. It doesn't sterilize anything because, again, you'll still have surviving spores. But it does minimize the amount of pathogens in the environment. Disinfectant. Remember, disinfectant, you're still going to have surviving microorganisms. Sterilization methods includes steam under pressure. Here, the instruments are placed in what's known as an autoclave. They're sterilized by gravity displacement. What that is that they get put inside, let's just say, a compartment, and pressure is added out of it so that it squeezes or pushes the contaminants off of the instruments. It's a high pressure system. Okay? And then they also use moisture to collect these contaminants, and they drip off the instruments and it's collected in some kind of receptacle. This is autoclaving. Okay? Chemical sterilization. Okay? Remember, this is sterilization, so are we also getting rid of the spores? Okay? So chemical sterilization, we use low temperature at about 54 to 60 degrees Celsius. And we also may add antimicrobial and sporicidal gas agents to remove the contaminants. Then you have ethylene oxide, used for items that cannot withstand moisture and high temperatures. The instruments that we use are not all going to be stainless steel. Sometimes it may be plastic, it may be resin, it may be carbon. So depending on what you're trying to sterilize, there are different methods for it. Okay? Any questions? All right, guys, we're done for today.